Dr. Richardson and nurse Amanda Turner were approaching the most critical moments of a lengthy heart surgery. Dr. Richardson's eyes were watering from exhaustion and his hands had started to tremble slightly. "Amanda, we need to finish this case quickly. We're both very tired. I don't want to make any mistakes," he said breathlessly. At the most critical moment of the long and grueling heart surgery, while completing the vascular anastomoses, Dr. Richardson's face suddenly turned pale. Sweat beads settled on his forehead, and he clutched his chest. "Amanda, I can't breathe," he stammered. Suddenly his knees buckled and he collapsed to the operating room floor. The patient's heart was beating irregularly on the monitor, blood pressure dropping. At that moment, Amanda did something very different from the panic around her. She maintained her composure and glanced at both Dr. Richardson and moved toward the operating table. "I will complete the surgery," she said with determination. The other nurses looked at her in shock. "Amanda, you're a nurse, not a surgeon." But Amanda had already taken the scalpel in her hand because the operating room wasn't a foreign place to her. And in the next 3 hours, everyone at Mercy General Hospital would learn who Amanda Turner really was, because some people wear nurse uniforms but actually have surgical training. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments what city you're watching from and hit that subscribe button. Amanda Turner was Mercy General Hospital's most reliable operating room nurse. The 31-year-old blonde had been working at the same institution for 3 years. She delivered flawless performance every shift, systematically prepared surgical equipment, and maintained perfect coordination with doctors. With her golden blonde hair neatly tucked under her surgical cap, Amanda maintained professional distance while still conveying warmth in her approach to patients. Her green eyes carefully followed every surgical procedure, and the steadiness of her hands gave confidence to the doctors. Amanda's surgical team consisted of Chief Physician Dr. Richardson, anesthesiologist Dr. Martinez, and assistant technician Sarah Johnson. Richardson was a respected 50-year-old doctor specializing in cardiac surgery with 20 years of experience. Martinez was a meticulous 42-year-old specialist who had been administering anesthesia at Mercy General for 12 years. Amanda's surgical approach was far above standard nursing protocols. During preoperative preparations, while others performed routine checks, she organized surgical instruments with military discipline, planning every detail in advance. "Where did you learn this precision?" they would ask. "Experience," Amanda would say briefly. Amanda's equipment management was distinctly different from her colleagues. She would check surgical instruments as if preparing for war, organizing emergency supplies as if preparing for a critical operation. "We're just nurses, Amanda, not commandos," they would joke. Amanda Turner had joined the Army at age 18. She had lost her mother to a sudden heart attack during her childhood years. Her 38-year-old mother had suffered a heart attack and couldn't be saved in time. Amanda was only 14 years old. That day, she made a promise to herself. "I will get the most advanced surgical training." When she joined the Army, she chose the Field Surgical Specialist program. After basic military training, she was selected for special surgical training. The Army Field Surgery program was a 20-month intensive surgical training process, surgery under combat conditions, life-saving with minimal resources, surgical operations under enemy fire. Amanda ranked in the top 3%. "A field surgeon isn't just a medical specialist," her training commander had said. "You're the person making life-and-death surgical decisions. Even under bomb explosions, you'll be operating on wounded soldiers." The most challenging part of her training was surgical operations in combat zones, surgery under enemy attack, performing complex surgical interventions with basic tools. Amanda had gained extraordinary skills in these areas. In her first deployment, she was at the Forward Surgical Hospital in Afghanistan. Surgical operations in combat zones, operating on wounded soldiers after explosive attacks. Amanda's most critical intervention was saving a major severely wounded in a rocket attack. In her second deployment, she was with the Combat Surgical Support Team in Iraq. Surgical support in urban warfare, emergency surgeries after insurgent attacks. The techniques she learned in these deployments were methods never used in civilian hospitals. Her third deployment was classified surgical operations at the Syrian border. surgical assistance in covert operations, medical support for special forces. Amanda had now gained surgical expert-level competency in all types of geographical and operational conditions. Over 10 years, Amanda had successfully completed 164 critical surgical operations. So why had she left the Army to become a nurse? This story was more complex. PTSD, adaptation problems, civilian life challenges. Amanda's transition hadn't been easy. High-pressure surgical work felt familiar, but civilian procedures were different, and this tension would explode that day. After receiving an honorable discharge in 2021, Amanda had transitioned to the civilian healthcare sector. She used PTSD rehabilitation, adaptation counseling, and career transition support. Operating room nursing had been an ideal choice. When Mercy General Hospital hired her, Amanda was overqualified. Nursing degree, 10 years of military surgical experience, field surgery certificate, but the hiring committee hadn't asked detailed questions. "I've always wanted to work in the operating room environment," Amanda had said, and this time she was completely sincere. Daily work was comfortable compared to combat surgery, surgical preparation, doctor assistance, patient care. But Amanda was doing much more. She evaluated every case from a field surgeon perspective. "Amanda, how do you understand surgical procedures so well?" her colleague Sarah would say. "Observation," Amanda would say. "Every surgery is educational." When her Tuesday evening shift began, Mercy General Hospital had an intensive surgery schedule. 3 complex operations were planned consecutively in the cardiac surgery department. Dr. Richardson and Amanda had started working non-stop from 9 a.m. The first surgery was completed in 6 hours. Triple bypass surgery successful. The second operation took 4 hours. Aortic valve replacement flawless. When the third and most challenging surgery began, it was past 8 p.m. 49-year-old Jennifer Walsh's condition was critical. Multiple vessel blockage after massive heart attack, complex reconstruction surgery was required. This was the most dangerous operation of the day. Dr. Richardson and Amanda had been working non-stop for 11 hours. Signs of fatigue were clearly visible in both. Dr. Richardson's hands were slightly trembling. Amanda's reflexes were also slower than normal. "Amanda, we need to finish this case quickly. We're both very tired. I don't want to make any mistakes," Dr. Richardson said, struggling to breathe. Amanda assessed the situation. Richardson's condition was concerning, but Jennifer Walsh's life was in danger. "Doctor, I can help. We'll handle this together," she said in a supportive tone. When Jennifer Walsh's chest was opened, the severity of the situation became apparent. Extensive damage to the heart muscle, complete blockage in 3 main coronary arteries. This surgery was one of the most challenging cases in Dr. Richardson's career. "Amanda, this is very complex," Dr. Richardson said while sweating. 3 different bypasses and myocardial repair are needed." The surgery began. Dr. Richardson's experience kicked in, but fatigue was also taking its toll. His hand trembled slightly while placing the first bypass graft. "Doctor, would you like to rest a bit?" Amanda asked with concern. "No, we must continue. Jennifer can't wait," Dr. Richardson said stubbornly. In the second hour, the surgery became even more difficult. The damage to the heart muscle was larger than expected. Dr. Richardson was constantly wiping sweat, having trouble breathing. By the end of the third hour, they had reached the most critical stage. They needed to complete the final vascular anastomosis. Jennifer's heart was beating irregularly on the monitor. "Amanda, this last connection is very delicate," Dr. Richardson said with the scalpel in his hand. "We can't make any mistakes." At that critical moment, Dr. Richardson's face suddenly turned pale. Sweat was dripping from his forehead, and he pressed his hand to his chest. "Amanda, I can't breathe," he stammered, fear in his voice. "Doctor," Amanda's voice echoed through the operating room. Dr. Richardson fell to his knees, then collapsed to his side. He was having a heart attack. Anesthesiologist Dr. Martinez rushed to Dr. Richardson in panic. "Acute myocardial infarction, life-threatening situation," Sarah screamed. "Both patients will die. What are we going to do?" Jennifer Walsh's heart was beating irregularly on the monitor, blood pressure dropping rapidly. She had been left in the middle of open chest surgery. At the same time, Dr. Richardson lay unconscious on the floor, his pulse weakening. "The nearest cardiac surgeon is 45 minutes away," Dr. Martinez said, "but neither of them can wait that long." Amanda's mind calculated within seconds. Jennifer's heart would stop within 10 minutes. Dr. Richardson had also suffered a heart attack. 2 people were about to die. At that moment, Amanda remembered the most important rule her 10-year military training had taught her. In a multiple casualty situation, determine priority, move quickly, don't lose anyone. "Dr. Martinez, start CPR on Richardson. Sarah, get the defibrillator. I will complete Jennifer's surgery," she said in a commanding voice. Dr. Martinez looked shocked. "Amanda, you're a nurse. There are 2 patients. One had a heart attack. I won't lose either of them." Amanda's voice resonated through the operating room with power and determination. She quickly put on surgical gloves. Her 10-year field surgery training had kicked in. This was the multiple casualty management she had learned on the battlefield, saving multiple dying patients simultaneously. "Martinez, while performing CPR on Richardson, report his vital signs audibly. Sarah, keep both the defibrillator and surgical instruments ready." Amanda looked at Jennifer's open chest. The final bypass connection was left incomplete. The heart muscle was damaged. Irreversible damage would begin within 10 minutes. When she took the scalpel in her hands were no longer trembling. Her eyes were no longer tired. Staff Sergeant Amanda Turner had taken over. "Richardson's pulse is very weak," Martinez shouted while performing CPR. "Blood pressure critical." "Jennifer's last bypass connection completing," Amanda said while simultaneously performing surgery and monitoring Richardson's condition. Amanda's hands were dancing between 2 different tasks. 1 second the anastomosis in Jennifer's heart, the next second checking Richardson's pulse. "Defibrillator ready," Sarah shouted. "Wait! First, I need to stabilize Jennifer's cardiac output." Amanda was performing surgical procedures while looking at Richardson. This was like that night in Afghanistan. 5 wounded soldiers, 1 Amanda, minimal equipment. But that night she had saved them all. 200 joules to Richardson," Amanda shouted while placing Jennifer's final suture. Shock! Dr. Richardson's body jumped. "Sinus rhythm returned," Martinez shouted. At the same time, Amanda was completing Jennifer's final bypass connection. Jennifer's coronary flow restored. 3 hours and 45 minutes later, something incredible had happened. Amanda had saved both patients. Jennifer Walsh's heart bypass surgery had been completed perfectly. Vital signs stable, heart rhythm normal. Dr. Richardson's heart attack had been stabilized. Thanks to CPR and the defibrillator, his heart rhythm had normalized. "Both patients stable," Amanda said while removing her gloves. She was covered in sweat, but there was a light of victory in her eyes. Sarah was crying. "Amanda, how did you save 2 people at once?" Dr. Martinez just stared. This is a performance that should be in medical literature." Amanda knew it was time to reveal her secret. Dr. Martinez looked at Amanda in shock. "Amanda, you're a nurse, not a cardiac surgeon." "I know what I'm doing," Amanda said while putting on surgical gloves. Sarah screamed in panic. "Amanda, this is heart bypass surgery. You can't do this." But Amanda had already begun organizing the surgical instruments. Her 10-year field surgery training had automatically kicked in. This was her expertise. "Dr. Martinez, apply CPR and provide emergency medical support to Richardson. Sarah, keep surgical instruments ready. I will save both patients." While Amanda monitored Dr. Richardson's condition, she also focused on Jennifer's open heart. Multiple blockages in coronary arteries, damage to heart muscle, complex reconstruction needed. "Dr. Martinez," Amanda said while looking at both Richardson and Jennifer, "I won't lose either of them." Amanda took the scalpel in her hand. After 10 years, field surgery training was reactivating. But this time, it wasn't just 1 patient, 2 lives were in danger. "Continuing Jennifer's coronary bypass," Amanda said. "Sarah, aspiration and retraction. Dr. Martinez, monitor both patients' vital signs." Amanda's hands began working with surgical precision. While repairing Jennifer's heart, she was constantly monitoring Dr. Richardson's condition. Richardson's pulse is stabilizing, Dr. Martinez said, but still unconscious. First bypass graft completed on Jennifer, Amanda said, starting second vessel access. This was the multiple casualty management skills she had learned on the battlefield. Managing multiple critical patients simultaneously, optimizing resource allocation, determining vital priorities. Sarah watched in amazement. Amanda, how are you managing 2 patients at once? Amanda didn't answer. That night in Afghanistan came to mind. After a bomb attack, 5 wounded soldiers simultaneously. Minimal equipment, maximum expertise, all saved. Dr. Martinez, Amanda said while coordinating both patients, watch Richardson's heart rhythm, intervene if there's arrhythmia. 2.5 hours later, Amanda had delivered a magnificent performance. Jennifer Walsh's heart bypass surgery had been successfully completed, Dr. Richardson had also been stabilized. Both patients stable, Amanda said while removing her gloves. Dr. Martinez couldn't believe it. Amanda, this is an incredible performance. How did you manage 2 critical cases simultaneously? Sarah was still in shock. Amanda, you're a real surgeon. Amanda knew it was time to reveal her 3-year secret. I served as a U.S. Army field surgery specialist for 10 years, Amanda said. Multiple trauma management, battlefield surgery, saving multiple patients simultaneously. The next morning, there was major change at Mercy General Hospital. Amanda's story reached hospital management. Chief Medical Officer Dr. Thompson called an emergency meeting. Amanda, last night's performance was extraordinary, saving both Dr. Richardson and Jennifer Walsh simultaneously. Thank you, Dr. Thompson, but you need to learn about my real identity, Amanda said. Amanda explained her situation. 10 years of military surgical experience, battlefield surgery expertise, multiple patient management, combat surgical leadership. Dr. Thompson was amazed. You're our hospital's most valuable asset. Would you manage the emergency surgery department? Amanda hesitated. I prefer to stay in patient care. The families of Jennifer Walsh and Dr. Richardson came to the hospital when they learned about Amanda's story. Ms. Turner, said Jennifer's husband, I don't know how to thank you for saving both my wife and Dr. Richardson simultaneously. I just did my job, Amanda said. After Dr. Richardson recovered, he came to Amanda. Amanda, that night you saved both my life and Jennifer's. You're a real hero. Dr. Richardson, we're all a team. We protect each other. Amanda still works in the same nursing position at Mercy General Hospital. Jennifer and Dr. Richardson have completely recovered and returned to their normal lives. One day, Hospital Director Roberts asked Amanda, Amanda, do you ever regret leaving your great military career? Amanda watched the team working in the operating room. They were providing surgical care to patients, saving lives. No, Roberts, I protected soldiers for 10 years. Now I protect civilians. Same mission. Amanda pointed to the patients. Yes, the life-saving mission never ends. Only the location changes. Amanda's story isn't just a heroism story. It's also the story of surgical expertise finding meaning in civilian life, the instinct to serve, and never giving up. Because sometimes the greatest surgeons walk hospital corridors as nurses to save lives. If this story moved you, share it, subscribe, and help these important stories continue. See you in the next legend. And remember, the nurse at the next hospital you visit might have surgical skills you never knew about. Real healers change their uniforms, but never their missions.